Improve Mental Health Access for Medicare Beneficiaries by Loveland Imo Aaron, University of North Carolina at Wilmington, NSG 398, Health Policy, October 21st, 2018. In recent times, the issue of expanding access to professional mental health care for Medicare beneficiaries has generated increasing attention. One reason attributed to this attention is the shortage of qualified providers, especially in the rural areas, which accounts for about 1/4 of Medicare beneficiaries. The Substance Abuse and Mental Health Services Administration, in its 2013 report to Congress, reported that 77% of U.S. counties have a shortage of mental health workers. The problem of shortage of mental health workers is compounded by the willingness of psychiatrists to accept Medicare payment for their services. Another reason for increasing attention on improved access to mental health professionals is the overwhelming importance associated with good mental health. According to the World Health Organization, mental health is crucial to the overall well-being of individuals, societies, and countries. Therefore, when left untreated, mental health problems can affect the overall health with significant impact on the quality of life. The Mental Health Access Improvement Act of 2017, House Bill 3032, sponsored by Representative John Katko and Mike Thompson, is a bipartisan attempt by Congress to expand the access of care for seniors. The Act allows for the coverage of services of marriage and family therapists and mental health counselors to be reimbursed under Part B of Medicare program. The purpose of this paper is to conduct an analysis of Mental Health Access Improvement Act of 2017 and provide evidence to show the importance of supporting the actualization of the House Bill 3032, the Mental Health Access Improvement Act of 2017. Efforts to expand mental health access for seniors by including marriage and family therapists and mental health counselors in the Medicare program have been ongoing for more than a decade, starting with the 107th Congress, with limited success. Though the House and the Senate have independently passed bills adding Medicare recognition, both chambers of Congress have not concurrently passed legislation with Medicare recognition of marriage family therapists and mental health counselors. For a bill to become law, it has to be passed by both chambers of Congress during the same congressional season and signed into law by the President. Mental Health Access Improvement Act of 2017, another attempt aimed at the House at expanding care for seniors, is currently in the House Subcommittee on Energy and Commerce and Ways and Means. It has a bipartisan support of 77 members, 52 Democrats and 22 Republicans, with a 25% progression rate. The bill is currently stuck at the committee stage. At this stage, experts, lobbyists, and government officials present their views in support or opposition of the bill. If the bill survives this stage, it is sent to the floor for debate. The bill eventually goes to the Senate if it passes the House of Representatives and to the President for his signature or veto if the bill passes the Senate. Various advocate groups are currently supporting Congress' effort to pass House Bill 3032. Among these groups are the National Council of Behavioral Health, the American Health Counselors Association, the National Board of Certified Counselors, the National Retiree Legislative Network, and a host of others. Outright opposition for this bill has not been located. Mental illness can have serious consequences, leading to many health challenges. According to the National Council for Behavioral Health, individuals aged 65 and older have the highest rate of mental health-related hospitalization and a suicide rate that exceeds the rest of the population. Yet, they are least likely to receive mental health services. One reason for not receiving mental health services is the financial constraint faced by Medicare beneficiaries. In addition to the financial constraint, a serious impediment for accessing care is the scarcity of qualified mental health professionals willing and able to accept Medicare beneficiaries, resulting in poor mental health. Poor mental health has been associated with suicide, increased hospitalization, increased risk of other health problems, substance abuse, social isolation, and significant health costs to individuals, family, and country. Expanding access to mental health providers by allowing marriage and family therapists and mental health counselors to bill Medicare may be important for policyholders to draw conclusions on health savings and quality of care provided to seniors. Marriage, family therapists, and mental health counselors are licensed for independent practice in all states and have comparable training to clinical social workers and mental health clinical nurses. Yet their services are not reimbursable by Medicare. Expanding access, apart from solving the critical shortage of providers, may result in growth in the career paths of marriage and family therapists and mental health counselors. The importance of mental health counselors and marriage family therapists in the treatment of mental illness cannot be overemphasized. Their recognition and use will decrease the pressure at the emergency rooms as a result of early detection and intervention. The emergency room will cease to be the first point of call of mental health issues. According to the American Counseling Association, in addition, early detection and intervention will lower Medicare costs as a result of using community-based marriage family therapists and mental health counselors. And it is expected that the rate of reimbursement would be 75% of the psychiatric rate to mental health services. Furthermore, expansion of mental health services by enabling the services of marriage family therapists and mental health counselors to be reimbursed will ease the waiting list of psychiatric care, especially in the rural areas. Furthermore, the importance of nurse advocacy and education of mental health services is vital. Such advocacy and information dissemination will expand the public's knowledge on the availability of marriage, family therapists, and mental health counselors, especially among our seniors and citizens who live in the rural areas. For over a decade, policymakers have been faced with the challenges of expanding access to mental health for Medicare beneficiaries without success. This is because mental health illness and substance abuse disorder among seniors continue unabated with serious life-threatening consequences. The 115th Congress has introduced the Mental Health Access Improvement Act of 2017, House Bill 3032, to allow the service of marriage and family therapists and mental health counselors to be reimbursed under Medicare, allowing qualified mental health care professionals and therapists participate as providers, especially in the rural areas, with a shortage in mental health practitioners will increase the availability of their services to the adult patient and save costs and improve the quality of life.